Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic in Maryland, across the world, and also at GBMC. So over the past 2 weeks, we've seen a very modest increase in coronavirus cases in Maryland hospitals. This was to be expected as our citizens start to turn indoors because we know that the rate of transmission increases as we get closer together, and perhaps as ventilation is not quite as good. When we are outdoors, there's a constant turnover of the air that we're breathing, and it is harder to transmit the virus out of doors. So it'll be important for us to continue social distancing, the wearing of masks and washing our hands, and to be very cautious when we are indoors. As businesses reopen, they will maintain caution in bringing large numbers of employees in relatively small spaces. It will be much better for people to continue to work from home if they can. Certainly, there are businesses where that is not possible, and in those cases, businesses need to continue to create space for people to stay 6 feet apart. They need to require people to be wearing masks in common areas, and they need to make it easy for their employees to wash their hands frequently. At GBMC, we have 13 patients who are COVID-19 positive at this moment. We have 2 of those 13 on ventilators. We continue to see that our team of clinicians is getting better every day at treating people with coronavirus infection. So the probability that somebody who is sick enough to get into the hospital makes it to the intensive care unit has gone down. Let me take a moment to talk about vaccines. We all know that there are multiple vaccines that are in trials right now. Those trials are overseen by scientists, and they have to prove 2 things. One is vaccine safety. Obviously, we do not want to give our people a vaccine that could hurt them. The second thing that the trial has to prove is that the vaccine is actually efficacious, that somebody who gets the vaccine is at significantly lower risk of acquiring the disease than somebody who does not get the vaccine. The process for determining safety and efficacy is well thought out, and the oversight by the Centers for Disease Control and the Food and Drug Administration is real and strong. I've spoken with friends and people in the community who are afraid that the vaccines will just be pushed out into production and people will not know whether or not they are safe or efficacious. I am not concerned about that at all. I believe that if, in fact, someone tried to run around the procedures, that there would be such a clamoring in the scientific community that it would not be successful. So I believe that when the vaccines are put out for the use of the general public with the Food and Drug Administration stamp of approval, that they will be safe and effective. Now, how effective will the vaccines be? We don't know yet. But if the vaccine is 65, 67, 70% effective, I will be in line to get the vaccine. So stay tuned. Vaccines are on their way. They are the prime way for us to get to so-called herd immunity, such that we can see the beginning of the end of the coronavirus pandemic. While I'm on the topic of vaccines, let's talk a bit about the influenza vaccine. Flu season is about to start. The influenza vaccine is available. I've gotten my flu shot. I would encourage all of you to get your flu shot. Why? Well, you don't want to get the flu. And also, if you get sick, you want to be able to tell your doctor that you have had the flu shot, because it'll be more difficult this season for clinicians to sort out who has the flu from who might have COVID-19. Please get your flu shot. Thank you very much. And I'm going to end this, as I always do, thanking the doctors, nurses, and other clinicians for standing up against COVID-19 and helping us fight the pandemic. And I also want to thank the members of the community. Because you are following social distancing, wearing your mask, and washing your hands, we are keeping the number of cases down, and we are helping the community to move forward. So thank you very much. Keep it up.